Hello, everyone. My name is Samhita Vinay, and I'll be presenting about the role of science communication during the COVID-19 pandemic. Before we dive into the content, here's a bit about myself. I'm a rising senior at Thomas Jefferson High School for Science and Technology in Virginia, where I'm the captain of my school's Science Olympiad team. I'm a computational neuroscience research intern at George Mason University and lead a science communication related organization known as Sci for Teens. My interest in science communication led me to pursue further research into the topic that I will be presenting about. In college, I hope to pursue the intersection of biology, computer science, and engineering, along with the communication strategies in the aforementioned fields. Now I'll dive into a brief introduction into science communication. Science communication is a field of science that aims to educate people about scientific topics through easy to understand media. Although there are diverse media to use, several popular ones that people use to communicate their science include writing, art, social media, blog posts, videos, infographics, posters, and visualizations. This field is of great importance, especially in relation to the COVID-19 pandemic, because it can reduce vaccine hesitancy and democratize COVID-related information. I will be speaking about these two topics later in my presentation. Now we'll move on to a rather disturbing statistic. Unfortunately, as of June 19, 2021, there have been over 3.8 million deaths worldwide as a result of the COVID-19 pandemic. This pandemic has been at the forefront of global health research lately. One specific governing body that has been researching and giving guidance on the disease is the World Health Organization, which has been spreading guidance on vaccinations, displaying case visualizations using science communication techniques. The pandemic has also revealed gaps in health equity, as some groups are more disproportionately affected by misinformation and disinformation, which will be elaborated on later in this presentation. As mentioned, now I will speak about vaccine hesitancy and its relation to science communication. According to Rzymski et al., there are 5 general strategies that science communicators, scientists, and health policy experts use to communicate their message during the COVID-19 pandemic. The first one is what I call expert groups. In this strategy, experts should come together and write a standard white paper educating people about COVID and its vaccines. In the trace misinformation strategy, people should track false information about the disease on social media and perhaps write a paper busting such myths. In addition, experts can ask politicians and celebrities to promote factual COVID-related information. And these same people can write about why they made certain decisions about COVID, such as why they decided to get vaccinated. Lastly, experts can implement a zero-tolerance policy, where people and experts can immediately report false claims about COVID. The paper suggested that a tool can be used to do this, and it also suggested that news headlines should not be sensationalized to avoid potential misinterpretation by the general public. One example of the aforementioned strategies being used is in the We Can Do This campaign, initiated by the US Department of Health and Human Services to encourage vaccination. This campaign consists of various activities to educate the public, including how to slow the spread of the virus, encourage people to trust the vaccine, and prepare vaccinations for more and more Americans. I've talked a lot about vaccines until now, but I would also like to dive into part of the reason why vaccine hesitancy, along with certain other myths about COVID-19, are perpetuated, which is misinformation and disinformation. While the mainstream media continues to speak about misinformation and disinformation, an aspect is notably not touched upon as often. According to Vishwanath et al., racial minorities in the United States are more susceptible to misinformation and disinformation about the pandemic. This graphic, produced by the Pew Research Center, was also part of the paper by Vishwanath et al. And although it shows that the white sample scored higher than all the other populations on a science knowledge test, Both with and without college education, what is striking is that the white sample without a college education scored higher than the Black sample with a college education. As disturbing as the previous statistics were, there could be several reasons for this inequity. To begin with, while there is a media focus on misinformation and disinformation, there is no apparent mainstream focus on the groups that they disproportionately impact. Moreover, several papers have mentioned the knowledge gap hypothesis, which states that people in a higher socioeconomic status are more likely to absorb accurate information from the media and scientific sources. This likely occurs due to the fact that people of higher socioeconomic status have more access to such accurate information. Perhaps the inequities can be at least slightly mitigated by increasing media focus on specifically the inequities in misinformation and disinformation, along with the knowledge gap hypothesis. As mentioned, the science communication strategy of zero tolerance may also be implemented so that the spread of misinformation and disinformation can be reduced. Overall, there were two primary aspects of this presentation that I focused on. The first one being vaccine hesitancy. I mentioned several strategies that science communicators use to combat this, and they have likely helped to some extent, considering that the US has a relatively high vaccination rate as of now, although this could be improved. Second, I spoke about inequities in misinformation and disinformation and how more awareness is needed about the issue in order to at least make a dent in solving the problem. Here are some of my references. And thank you so much to my parents for supporting me throughout my STEM journey, the Global Health Leaders Conference for giving me a platform to speak, and thank you all so much for listening.